one of the things that's always a journey is sizing, profile, etc. that all the patients want to go over. And it's really hard to find kind of like your twin, which is I think Krystle spent.
I spent like 2 hours researching this.
She's becoming a typical patient. We already kind of know what profile, and because she's quite thin and she doesn't want that ball projection look, which is important in smaller and thin patients, is we don't want to go with a super full profile. We want the profile and projection to be a little bit softer, and so we are going with a moderate profile with her. The second thing that we're deciding now, the cohesivity of the implant, which is, just to keep it simple, do we have it here? Soft, medium versus cohesive. But if you look from eye level here, you can see that this is the fullest projection here. And most women like and want kind of some definition and cleavage. So most of the time we'll go with this. This is the softest, called the Inspira, okay, where we see a little bit of less fill here. So that we know that when we kind of sit it up like this, you'll have kind of a softer upper pole transition. Or let's now go to this one, which you can see is less projection. It's not going to project as much as this one, but it's filled more. And you see it's not shelving as much, so this we can consider to be more of a medium cohesivity. It's a little bit stronger, and then when we sit it up, it's not going to have as much. It's going to fill it a little bit more, okay, in this upper pole. She's wanting a little bit more of this right here, see how like right here there's just a little bit of fullness here. We're wanting a little bit of that cleavage right there.
I'm excited. I did a lot of research. Wish pics are done.
Good. So how are you feeling? Are you feeling more excited now that you have your size picked out and you've looked at your wish pics? Are you feeling nervous?
I'm not so nervous. Everything on my list that I have to do is checked. Like, I made sure I did my research. I got the implant size, the shape that I wanted. So I feel like I'm all set now, so I can relax a little bit.
Enjoy the journey.
Yeah.
We're really excited for you.
I'm definitely going to follow doctor's orders, even though we all know that's really hard. We might want to start going to the gym a little bit sooner than he says, but I'm definitely going to try and stick to it. Dr. Park, I'll listen to you. Listen to what you say. I definitely don't want to overdo it, go back into the gym too soon.
Like, how long have you been wanting implants? Has it been a while, or
Since like high school?
Yeah.
Back to those high school days when you have to do PE and you have to do swim. Like that, I dreaded having to put that bathing suit on. I just always felt like I was not as developed, as everyone else. We kind of planned it right because I am planning my vacation like the end of June, Dominican Republic.
Ooh.
So I'm excited, and we definitely wanted to give myself that full 3 months of healing. So that's another thing, planning your surgery right.
Just anything else that you would suggest for anyone who's thinking about getting implants while they're doing their research, or
definitely research, wish pics, trying to find pictures that are kind of your physique. You don't want to get pictures that are like way out of
a girl that
your
doesn't
frame.
really look like you.
Exactly.
Yeah.
So
That's good. That's very cool. Well, we're really excited. Tune in, guys, and we'll continue to follow Krystle on her journey. So we'll see. Here we go.
excited. Super excited. Tomorrow is my surgery. Super excited. Just a few things wanted to go over with you guys is definitely read your pre-op and your post-op instructions. It kind of tells you what to expect and also what to do before you have your surgery. Yesterday I was kind of rushing to get all the little details finished. I picked up my prescriptions. Make sure you want to have them filled before your surgery. So that way you don't have to worry about going or someone going before you to get those filled. Also, I did not have like a zip up or a loose fitting button up, so I had to go to a store and buy that. So pants, like not wearing anything super tight, especially after breast surgery. You're not going to be able to pull up those tight leggings, so you really want something that the nurses can help you get on. I made sure pretty much everything I'm going to need is like at my height, so I don't have to reach up or bend over to get anything like food or drinks. If you are going to be home alone for a little bit the next day, I do recommend you even twisting off the caps of like soda bottles, anything that you're going to be wanting to drink. Just read your pre-op post-op instructions, get your pain pills filled, and really think about the little details that you might not think about.